Hi, my name is Allie and I'll be your nurse today. I'm just going to start with some hand hygiene. Can you tell me your name and date of birth, please?
Hannah Hickey, August 14th, 1960.
Great, thank you. And what brings you in today?
Right ear pain.
Okay, great. I'm going to ask you a few questions about that ear pain, okay? So, how would you describe the character of it? Is it burning, throbbing, aching?
Burning and aching.
Good. And when did it first begin?
Last week.
And where is it located? On the inside of your ear, the outside?
Inside.
Great. And I'm going to ask you about the duration of it now. So, when it comes on, would you say it's constant or more intermittent?
Constant.
Okay, and then for the severity, I'm going to have you rank it on a scale of 0 to 10. 0 is no pain at all. 10 is the worst pain you've ever experienced. How would you go ahead and rate that?
7.
Okay. And then is there any things that make it better or worse?
No.
Okay, and then is there any associated factors such as nausea, vomiting, anything like that?
No.
Great. I'm going to ask you a few questions about your head now. Do you have a history of head problems?
No.
And do you have any headaches?
No.
And are you experiencing any dizziness?
No.
Okay, we're going to move on to your ears. Is there any ear discharge that you've experienced?
No.
And do you have any history of hearing loss?
No.
Okay, we're going to go ahead and do the eyes now. Do you have a history of glaucoma?
No.
And do you wear contacts or glasses?
No.
Okay, great. We're going to move on to the objective portion of your assessment now. So I'm going to go ahead and take your vital signs. At this point, I would take their vital signs. And then I'm going to go ahead now and ask you some questions just to evaluate your level of consciousness. Can you tell me your name, please?
Hannah Hickey,
Good. And can you tell me where you are?
University of Cincinnati Medical Center.
Great. And what's today's date?
November 23rd.
And why are you here?
Right ear pain.
Great. So while she was speaking on that, I'm also assessing her cognition and speech and her mood and affect. So I'm going to go ahead now and assess your eyes. I'm going to just shine the light in your eyes and just assess your pupils. Good. And then same thing over here. Good. That was perfect. So we're going to assess your extraocular eye movements now. So you're just going to follow my pin light and keep your head straight. Just follow it with my eyes. Okay. Good. Good. Great. And just 2 more. Good, that was perfect. So during that, I'm assessing for facial symmetry. And now I'm going to go ahead and assess your mucous membrane. So I'm just going to have you open your mouth and say ah. And just look in it with the tongue blade. Looks great. So after that, we're going to go ahead and move into the skin assessment now. So I'm just going to assess the upper extremities first. And so first I'm just going to assess for skin color, and it looks good and appropriate for her ethnicity. And skin color on the lower extremities, I would ask the patient to pull up their pant leg, but it looks good, and it looks good on the other side. I'm just going to assess for skin temperature now, so I'm just going to, great, same over here, and then I'm going to do it on the lower extremities, good. And then just finally skin moisture, so I'm just going to assess it, feels great, feels very normal. Same on the lower. Good. So now I'm going to assess your fingernails, and I'm just going to assess them for their color first. They look normal. And your toenails, and they also look normal. Then I'm going to assess your capillary refill. So for this, I'm just going to squeeze on your fingernail. It won't hurt at all. Good. Normal, less than 2 seconds. Great. I'm going to do the same thing on the toenails. Good. And good. So all those looked great. I'm going to go ahead and move on to your carotid now. So basically I'm just going to palpate it or touch it first, and then I'll go ahead and auscultate it or listen. So when I'm listening to it, I'm just going to ask you to hold your breath, but I'll tell you when. So I'm going to start by palpating it first. Good. And then I'm going to go ahead and listen, so hold your breath. Good, that sounds normal. And I'm going to do the other side now. Good. Hold your breath. Good. So both those sounded normal. I'm going to go ahead and listen to your heart sounds now. And so just breathe normally, and I'm going to listen in a few different spots. So we're going to start by listening at the aortic valve, then the pulmonic, then the Erb's point, tricuspid, and the mitral valve. Good, all those heart sounds sounded great and normal. I'm going to assess for your apical pulse now, so I'm just going to listen. And if this was a real patient, I would go ahead and listen to that for the full minute. So we're going to go ahead and move on to your lungs now. I'm going to start by assessing your respirations. And if this was a patient, I would tell them I was assessing their pulse, so it wouldn't affect their rate or rhythm of breathing. But so I'm going to go ahead and listen to your pulse for a full minute. Great. So her respiration rate was 18, and it was of easy effort, and the rhythm was regular. I'm going to go ahead and listen to your lung sounds now. So I'm going to start on the back, move to the sides, and then the front. Each time I move my stethoscope, I'm going to have you take a nice big deep breath in and out. So we'll start on the back. Okay, go ahead, breathe in and out. Good, those all sounded normal. We're going to go ahead and assess laterally now. So I'm going to have you put your hands on top of your head. And again, just a deep breath each time. Good. Good, you can go ahead and put your arms down. Those all sounded normal and great. We're going to go ahead and do the same thing on the front now. Again, just deep breaths in and out, please. Good, those all sounded normal as well. We're going to go ahead and move on to the abdominal assessment now. So I'm just going to have you lay your head down here and your feet over there, please. So if this was a real patient, I'd have her lift her shirt so I could properly inspect her abdomen, but right now I'm just inspecting. And then I'm going to go ahead and listen in each of the 4 quadrants. And again, if it was a real patient, I would auscultate for a whole minute each time. And 4. Great, those all sounded normal. I'm going to go ahead and palpate in each of the 4 quadrants now. Just let me know if there's any pain. 2, 3, and 4. Perfect, you can go ahead and sit back up now. Those all sounded great. So now we're going to go ahead and assess your pulses. We'll start with your radial pulse. And so I'm going to assess each pulse bilaterally, and each pulse would be for a minute normally. So that one, and then I'll go ahead and assess the other radial pulse. And I would ask the patient to remove her watch if I couldn't get a good reading. Then we're going to move on to the dorsalis pedis, and so we're going to go down to her foot and assess there. And again, it would be for a full minute, and then same thing bilaterally on the other side. Then we're going to go ahead and do her posterior tibial, which would be on this side, and then again the same thing over here on this side. Great. So after we assess her pulses, I'm just going to look for any edema on the upper and the lower extremities. So we'll go ahead and start on your upper extremities. I'm just going to inspect your upper extremities and just palpate them, just checking for any skin indentation that would be indicative of pitting edema. So that looks great. Good, both upper extremities look great. We're going to go ahead and do the lower ones. Again, I would ask the patient to lift the pant leg so I could properly inspect and palpate for the edema. But those look normal and great. So after assessing for your edema, I'm just going to go ahead and assess range of motion. So just, I'm going to give you some instructions and just follow them the best you can. So you're going to move your head forward, good, and back, great. Then side, good, to the other side, good. Then turn your head completely, then the other side, good. And then I'm going to have you stand up and just bend over, please, good. And then you can bend back, great. And you can sit back down. I'm going to have you bring your arms out like this, good, and then back in, and then you can cross them, good, and back down. Then one hand to your head, please, and then the other side, good, and then behind your back, please, good, and then good. That looks great. I'm going to have you flex your elbows and then extend them back out, and then your wrists are going to go in and then out, and then flip your palms over and then flip them back, good, and then bring your hands together and back out. That looks great. So we're going to go ahead and assess the lower extremities range of motion now. So I'll have you lay your head down again and bring your feet back up, and we're going to do each one bilaterally. So have your feet straight out first and bring your knee to your chest, good, and then back, and then the other leg, please, good. Then bring that knee back up again and twist it inward, good, and then outward, good. And then do the other side, inward, good, and outward. And then straighten them back out, and I'm going to have you bring this foot all the way up, good, and then that one all the way up, great. And then I'm going to have you bring it out to the side, good, and then the other leg, good. So that all looks great. I'm going to have you sit back up, and I'm just going to assess the range of motion of your ankles now. So I'm going to have you bring that foot to your shin, good, and then point it down, great. And then the other one, good, and then point it down. And then twist your feet inward, good, and then your other foot inward, good, and then outward, please, good, and then your other foot outward. Great, so that all looks good. We're going to go ahead and assess the strength of your upper extremities now. So I'm just going to have you push against my hand, good, and then this way, good, and then to the side, good, and then to that side. Good, that looks great. I'm going to have you put your arms out now, and go ahead and push up, good, and then down, great. Then bring your arms in like this, please, and push against me, good, and then pull, good, and then can you push outside, yep, and then inside, good, then inside, please, good, and then outside, good. All those feel good. I'm just going to have you shrug your shoulders now, good. So now we're going to go ahead and assess for strength in the lower extremities. So I'm going to have you push against my hand with your ankle first, good, and then point your toe, good, and we'll do it on the other side, good, and then back down, and then I'm going to have you push against my hand with your leg, and then back in, good, and then the same thing against, and then pull that leg back in. Good, that all looks great. So now I'm going to assess your gait. So I'm going to have you stand up and just walk about 5 steps in that direction, please, and then walk back, good. So your gait looks normal, and then I'm going to have you do the Romberg test. So just stand straight ahead, close your eyes, arms at your side, and I would have her do this for 20 seconds and just observe for any noticeable swaying. And then that's your assessment.